Okay, starting Monday and for the next 30 days, most people in Harris County, including the city of Houston, will have to cover their faces in public. Judge Hidalgo's order requires those 10 years and older to cover their mouth and nose outside the home. Now, you're exempt when you're exercising, eating or drinking alone in a separate space, at home with roommates or family. There's also an exception when wearing that covering would risk either security or your mental or physical health. Essential businesses must also provide face coverings and training to workers who interact with colleagues or the public.
Face coverings are not a substitute for social distancing, so we still have to continue to keep that distance from one another. And we are still under a stay home, work safe order. So we should not be out unless absolutely necessary. And if we do this, we will get that curve down to where it needs to be, to where we can actually begin reopening things and do so in a way that is sustainable.
And breaking this new rule starting Monday could mean a fine of up to $1,000. Houston's police union president called the measure draconian and said though he supports wearing masks in public, the union is reminding its officers they have the discretion with enforcement. The face covering mandate only impacts Harris County. Galveston, Brazoria, and Montgomery counties have already publicly said that they are not ordering the same requirement. If you're going to wear a face covering, make sure you do it correctly. That includes safely putting it on and taking it off. Stephanie Whitfield explains.
The CDC thinks 25% of people may have COVID-19 without ever showing symptoms. That means they're spreading the virus without knowing it. That's why officials have changed their thinking about the public covering their face. It's not to protect you, but to protect others in case you're sick. Health officials in Harris County are requiring face coverings, not masks, because these are for medical workers. Save masks for them. You should use a cloth face covering, like a scarf, bandana, or anything homemade. It should cover your mouth and nose to keep your cough or sneeze from spreading. The CDC says it should fit snugly against the side of your face, be secured with ties or ear loops, include multiple layers of fabric, and allow for comfortable breathing. And just as important, taking it off properly. Because after going out in public, there could be germs on the outside of the face covering. Be careful not to touch your eyes, nose, or mouth, and wash your hands immediately. Cloth face coverings should be washed regularly. How often depends on how often you wear it. The CDC says a washing machine should do the trick. Doctors say a big concern is these give people a false sense of security. Remember, cloth face coverings don't protect you from getting the coronavirus. You still need to practice social distancing, washing your hands, and try not to touch your face. Stephanie Whitfield, KHOU 11 News.